Hello, I'm Zach Pemberton-Whiteley and I'm the Chief Executive at Leukaemia Care. Every year, around 10,000 people are diagnosed with leukemia in the UK. That's 28 people every single day. Leukaemia Care reach millions of people every year with our Spot Leukaemia campaign, but despite our best efforts, awareness of the signs and symptoms of leukemia is still dangerously low amongst the public, as well as healthcare professionals in primary care. Unfortunately, many people aren't aware of the signs and symptoms until they or someone they know is diagnosed, and the non-specific nature of these symptoms can make it hard to spot. The most common symptoms of leukemia are fatigue, bruising or bleeding, repeated infections, shortness of breath, fever or night sweats, bone or joint pain. Early diagnosis has a significant impact on the survival and experience for leukemia patients. This is why we launched our Spot Leukaemia campaign to help the public and healthcare professionals in primary care to spot leukemia sooner.
I'm Charlotte, Patient Advocacy Manager here at Leukaemia Care. The COVID-19 pandemic has impacted greatly on those already diagnosed with leukemia, as many have been shielding for many months. It may have also prevented those with symptoms of leukemia from seeking help. In England, between April 2020 and March 2021, there were 2,400 fewer referrals for suspected haematological cancers. That's 11% down on prior to the pandemic. Data on emergency presentations also shows a small increase in the number of emergency presentations for different types of leukemia between Q4 of 2020 versus Q4 of 2019. The baseline level of emergency presentation in leukemia was already significantly higher than that of other cancers, so any small increase on this bad baseline is a concern. We urgently need more data to enable us to understand any setback that the COVID-19 pandemic has caused on early diagnosis rates. Our Spot Leukaemia campaign is more important than ever before.
Now we will hear from Bansri. When Bansri began to feel fatigued, she went to see her GP, who advised her to take iron supplements. Yet as Bansri's symptoms progressed, she knew something wasn't right. She listened to her gut and got the blood test she needed to diagnose T-cell acute lymphoblastic leukemia. Here, she shares her Spot Leukaemia story.
My name is Bansri Dokya. I was diagnosed with T-cell acute lymphoblastic leukemia in July 2020, which was right in the middle of the COVID pandemic. So for the few months before I was diagnosed, I knew that something was wrong. I didn't know what it was, but I was repeatedly going to the doctors. I'm quite an energetic person, but I found it really hard to concentrate at work, and it was just fatigue like I had never experienced before. So something else that I thought was explaining my fatigue was that I actually had a period for 3 months before my diagnosis. And so because of how much I was bleeding, I thought that the tiredness was due to my low iron levels at the time. And I mean, having a period for a week or 2 weeks can be draining enough, but having it for 3 months non-stop just made me really, really tired, and it was also really difficult to deal with. And that's why I was repeatedly going back to my GP to ask why this was happening. It was really, really depressing because at such a young age, you don't expect to experience breathlessness. But I would get breathless really easy from just walking up the stairs, going for a short walk, or doing an exercise, which normally I could do for half an hour to 1 hour. And I was just getting really out of breath, and I needed to constantly sit down and have water breaks. I think initially I just thought that it would get better. I just thought slowly it would get better. And after, I think it was 2 months of no improvement, I was repeatedly getting blood tests and hopefully looking for some answer, whether the doctor would tell me that I had a thyroid issue or, something that was hopefully quite easily treatable with medication. What was amazing is that I had 4 blood tests all within a month, and they all came back clear. It was my 5th blood test, and I was so busy at work, and I really didn't want to go. And I said, I've had 4 already. The 5th one is not going to say anything different. And my husband said to me, it's only down the road. It will be an hour out of your day. Just go, because you never know what's going to happen. And it was on the day of that 5th blood test where I was brushing my teeth and going to sleep, and I had a call from the ambulance, and they said, sorry, the ambulance is on its way to pick you up. And I obviously was absolutely shocked. And I just thought there's no way that ambulance is for me. So I actually called them back and they said there were abnormal results in your bloods. You need to come into the hospital. So pack an overnight bag. And it was unfortunate because the hospital walls were quite thin. And the hematology consultant was outside my room in the morning. And I heard him say the word leukemia. And I just burst into tears. And I called my husband and I said, you may need to come back to the hospital because I've just heard this word. So it was just everything happened within a day. And it was then that I had to call my parents. And I think the hardest thing was telling my parents over Zoom. Telling my parents over Zoom is one of those moments that I will never forget in my whole life. I remember texting my sister and I said, you need to get the family together because I have to tell you something. They knew something was wrong at that point because I've never done that before. And I just remember seeing their 4 faces on Zoom. And it was heartbreaking telling them that I had leukemia. And they all just burst into tears. And I have never cried that hard in my life. And it was, until this day, I think it was the hardest thing I've ever had to do, is break the news to them. And I knew from that moment, the next time they saw me, I would be a completely different person.
Next up is Dr. Sarah Smith, a GP who has worked closely with Leukemia Care and our Spot Leukaemia campaign to help raise awareness in primary care of the signs and symptoms of leukemia.
I'm Dr. Sarah Smith. I'm a GP and I work in a practice of about 9,000 patients in Monmouthshire. I work within a lovely team. And unfortunately, one of my team got diagnosed with AML, or her symptoms were hidden right up until the day of diagnosis. I think that was what fired my interest in the Spot Leukaemia campaign. My colleague had become more and more tired as time was going on with her symptoms, but she didn't tell anybody. She was getting her husband to drive her to work because she felt too exhausted to drive the car, but none of us knew. And it wasn't until one day she came in and was quite tearful and just said, I am so tired, I don't know what to do with myself. So I took a full blood count there and then and sent her home, and we got a phone call from the lab about 2 hours later saying that she had an abnormal blood count. So we talked about the realistic possibility that she probably had an acute leukemia. So the Spot Leukaemia campaign runs every September. It's to raise awareness of early diagnosis of leukemia. And really it's just to get the message out there to be aware of the symptoms of leukemia so that individuals know that they can go to their GP and that their GP will listen to their symptoms and arrange the appropriate test, which is usually a simple blood test to check what's known as a full blood count. I think a lot of people worry about symptoms at home, but that doesn't necessarily translate to a visit or consultation with a GP. And sometimes people are willing to tolerate quite high levels of fatigue and quite high levels of bone pain or breathlessness, or they just put their bruising down to being clumsy. And sometimes those things happen together and they don't recognise that those symptoms could be linked. So it's getting the message out there of when alarm bells should ring so that you do go to your GP for a blood test.
As you can see, those stories really show the importance and impact of Spot Leukaemia. Now we will hear from our campaigns officer, Emma Hyde-Nero, who will share with you some of the ways you can get involved in the Spot Leukaemia campaign this year.
Hi everyone, my name's Emma and I'm the campaigns officer at Leukemia Care. We have lots of exciting things planned for September and plenty of ways that you can get involved. Help us to spread the message of Spot Leukaemia by sharing our resources or patient stories online using the hashtag SpotLeukaemia. Anything you share with the Spot Leukaemia hashtag will appear on our live social media wall. So join the Spot Leukaemia conversation and help us to raise awareness of the signs and symptoms of leukemia. We also have spotty Instagram GIFs and Facebook frames for you to use. New for this year, we've introduced some spotty challenges, where you can complete various tasks such as using our spotty Facebook frame or popping a Spot Leukemia flyer in your window or even in your local GP or pharmacy to win Spotty prizes and a certificate. It's our way of saying thank you for helping us to spread awareness of the signs and symptoms of leukemia. Just head over to our social media or Spot Leukemia page to find out more. Thanks, guys.
Thank you for listening. I really hope you will join us in raising awareness of leukemia this September. Spot Leukemia. Early diagnosis saves lives.
I think spot leukemia is crucial. So many of the symptoms you have before you're diagnosed with leukemia are things that might be attributed to other things such as colds or flu or just feeling under the weather, but it doesn't take much for you to actually get a blood test and be able to have these kind of results that can be life-changing. But so often people don't get the blood tests that would show these problems until it's too late. So I think if I knew more about the symptoms, I would have been able to realize something was seriously wrong with me instead of just brushing it aside.
If it was just the bruises or if it was just the fatigue, I would have ignored it. But then the combination of the two really made me remember those posts and then Google the symptoms and then go to the GP. I think spot leukemia is important because it saved my life. Like I would have really had a tough diagnosis if it was not for spot leukemia. APL, they told me, is very dangerous in the first phase of the disease, especially because if it is not treated, there are a lot of bleeding and clotting problems that can really be life-threatening. So spot leukemia is really, really important, and it's important that people knows what the symptoms are, because if I'm here today speaking about it is also thanks to spot leukemia.
I think it's an important campaign because, first of all, the symptoms of leukemia are so incredibly vague. It's easy to write off symptoms in isolation. But if people were to have an awareness of what the symptoms are as a group, then maybe they could understand earlier on that actually they are experiencing both fatigue and breathlessness. And those two things together might be indicative of something more serious. I think if I'd been aware of the symptoms such as frequent infections and paleness and fatigue, I would have been able to go to my GP back in January 2019 and say, actually, I've got 3 symptoms that together could be indicative of something more serious, and I would like a blood test. But when I went to the GP, I wasn't armed with that knowledge. But now that I know what I know, I realise I did have leukemia at that point. I had detected that change in my body so early on in the disease. And if I'd been diagnosed in January 2019, my life might have turned out very differently. I might have been able to avoid having a stem cell transplant.